Never should give up. Like, you're going to do one thing or almost one thing for the rest of your life. You must fight for it.
Today, we're joined by Dr. Joao Vinha Oliveira, someone who never stopped learning. His journey from Portugal to France, and now Switzerland, reflects his dedication to restorative and aesthetic dentistry with a gentle, micro-invasive philosophy. He teaches, researches, and practices, all with a deep commitment to improving the patient experience.
How do you think it has changed the way we are able to do conservative and preventive dentistry more than, say, 10 years before or 20 years before?
Obviously, an evolution on materials, but for me, the evolution on conservative dentistry is more concentrated on early diagnosis.
How do you think we can change the industry to go towards prevention?
I don't think we can change the industry because the industry needs products to sell. This is quite delicate. I think the work must be done in early ages with patients. Education, but on patients.
The young dentists that are listening out there, what advice would you give them on which path or how should they start if they would like to be someone like you? Welcome, Dr. Oliveira.
Thank you. Thank you for the invitation.
No, you're welcome. Welcome. All the way from Spain and Switzerland, or now in Malaysia. This is the first time, so I heard this is your first time in Malaysia.
It's my first time in Malaysia. It's not my first time in Southeast Asia, but it's my first time
in
here.
Malaysia.
Yeah.
Welcome again, and thank you for finding time and coming to our podcast. Right.
It's a pleasure. It's a pleasure. Yeah.
Well, it's our honor to have gotten to know you. And I know you are amazing in what you do. I've seen your Instagram and the work that you do is amazing. So for those people who do not know you, do you mind giving us a little bit about your background?
Yeah.
What you've been doing, where did you go to school, and what you're doing now?
Yeah, of course. With pleasure. Yeah, I mean, I started my career in Portugal. So I did my studies there. And everything started from there. But when I was in college, I was really focused on pathology and surgery and stuff like this. I started doing some studies about it with a reference for me in Portugal, and I started showing my studies to the congress, some conference and stuff like this. And in the end, there was a switch that turned in my head, because at one time I was in Lisbon, so the capital of Portugal, and I went there to talk about oral cancer and stuff like this. And I did my presentation, and then I had nothing more to do. I would probably just sit around, see what's going around, and I started to listen to an Italian guy, a restorative Italian professor.
What's his name?
It's Roberto Spreafico. Yeah. And I was there for the whole day. He was speaking about restorative and composites and the whole day. And I was there. Okay. Wow, this is quite amazing. Okay. And the time went by, and another conference, I was with another Italian professor, another restorative team, and I said, okay, this is quite interesting, because I always was giving interest to manual work and stuff like this, and I start searching where these guys learn, where they come from. Okay, they are Italians, they are Swiss, but all of them have one thing in common. It was Geneva University.
Wow.
So I start learning and searching more in what's happening in Geneva that is not happening in Portugal. So in the end, I went there to Geneva. I tried to apply for this specialization, for this master. And I was refused. Not because of my skill, because I didn't speak
English.
French, because we needed to speak French
in order to be accepted to University of Geneva. Wow.
So I kept pushing, and in the end, I ended up in France, a couple of years to learn French, and then I tried again, and they accepted. It went pretty good. Thank you.
Wow.
Thank you. And it went pretty good, and in the end, they also invited me to be like an assistant professor, and now I'm just there. Yeah,
Yeah,
it became a dream. Yeah.
Oh my goodness. You didn't give up. You
No.
just went on.
Yeah.
And despite the language barrier, you learned French.
Exactly.
Yeah.
You never
Oh my
should
God.
give up. If you're really feeling it the way, you just need to think it's like you're going to do one thing or almost one thing for the rest of your life. You must fight for it. So, yeah.
No, that's what we need to hear.
Yeah.
And then to encourage the young ones, because everybody takes it seriously when they get rejected, and then they think that, oh, that's the end of it. But if you really want to do something, you're going to work all the way through.
Exactly.
Yeah.
Especially when you're like being rejected or being in a bad place, it's not so good for your mental health and stuff like this. But it's in this situation that you learn more, and then you'll find that you're capable of doing things that you didn't thought you were capable to do it. So it's not we don't learn nothing when we have good periods.
Yes.
So actually, the learning is when you're not doing so good. So yeah, just think like this.
Yeah, that's very positive, which is what we are trying to do in our podcast. It's easy to just go into negativity and then give up, but it's very hard to see the positive side when things are really bad.
Yeah.
So we should really think that. So you did your university postgraduate training program. Is it a Prost training program, or is it a restorative training program, or what do you call it?
It's actually a Master of Advanced Studies on Restorative Dentistry, because also in our university we have a fixed prosthesis program, like it's more Prosto, with Irena Saylor and Vincent Femer. So these are the true Prosto guys in the University of Geneva. But since Pascal Magne, Roberto Spreafico come from the restorative part of Geneva, so the department of restorative is really, really important. But it's more in a part of conservative, micro-invasion, giving priority more for materials that are repairable, like composites, and less invasive, let's say. So
that's very interesting, because it is always a blur line, and that's where it is so interesting to see the work you do, because you are all into conservation, all into using materials that are non-invasive and micro-invasion, like you say. Can you explain a little bit more how that's different from how we were trained as dentists?
Yeah, actually, my mindset completely changed when I arrived there, because I already knew a lot about materials at that time, but my mindset was a little bit more invasive. I was like thinking about the patient comes with a need, I need to treat it, and I need to deliver this treatment to the patient. Like this, he won't be bothered never again. So with time you learn that this is not possible. It doesn't matter what material they will find, and they still will create, and they will sell us like it's all going to be the revolutionary material. Nothing is forever. So what you can do, it's like to stretch the cycle of a life of a tooth. So if you don't have a good hygiene, like the patient doesn't have a good hygiene, when you start with a cavity, it's just the beginning. You will know that this tooth, one day you repair it today, so the composite will fail in 10 years or 15 years. You'll repair. You always have a cost, not only in a budget wise, but also in natural and biological tissue. And we'll hand in like 30 years with a endodontic treatment, and if this fails, so my professor that teach me, like, a little cavity is just the beginning of the life of the cycle of life of this tooth. So at one point it can end at 90 years, but you need to stretch the life of this teeth, if this teeth the most, like push it.
We're trying to maintain and protect the tooth.
So if you need to like to prevent, it's the main thing, like prevention. And then if you need to intervene, you need to monitorize it and be less invasive possible. With this being less invasive, there's also a concept that I didn't knew before. It's reparability. So being less invasive and choosing some materials that allow you to repair in the further future, this will avoid to remove the whole restoration each time. So if you do an overlay in ceramics today, for example, if you have a problem with this ceramic overlay, you will need to
cut the whole thing out. You need to cut the whole thing out.
Yeah, exactly. You need to, and then redo everything.
Yeah.
So, and each time you redo, you lose some tissue. So, prevent early diagnosis, resin, and in 10 years, if there's a problem, if you did a good protocol of adhesion, you don't need to remove the whole thing. You just need to repair it. Okay. And even if one day you need to do this indirect restoration with ceramics, you know this ceramic at one point probably it will fail mechanically or in what concerns to adhesion. So the only thing that needs to go off should be the ceramic and not the tooth. So if it breaks, only the ceramic. So protect the tooth at what cost. And my colleagues don't like too much because I work with surgeons, implant dentists. So I'm trying to do everything to not give them work,
No, but that is so important because that's so important. I think the more we do surgeries, the more we realize that the retrievability and there's a lifespan for implants, just like how you're saying there's a cycle of life for tooth, and nobody wants to talk about the cycle of life of implants too. And in the patient's mouth, there is not just one tooth, there's so many teeth, and we are not taking the prevention. But I think I mean, if you are a patient ourselves, I think as dentists, I think put 100 of us in a room, most of us will choose your pathway to try and protect our teeth. More than anything else.
Exactly.
I think that's the fact of life.
When I tell to my patients, if it was your kid or your mother, like, what would you do? Just remove it and put an implant, or just do whatever you can? Of course, it needs to be logic. You're not a superhero, you're not Spider-Man, you can save everything. That's one good thing actually that I learned there also in Geneva. The knowledge of materials and reparability and conservation will also put you boundaries to not always suggest conservation, because sometimes things are irreparable, and then you need to be have courage enough to tell the patient, no, this is not reparable. Don't invest time and money to do my work, so go straight away to see my colleague. You need to be humble enough to say it.
Being humble enough and being able to recognize the limits of every treatment protocol. It's very, very hard, I think, in dentistry.
Because everyone it's pushing for their side, and everyone, every kind of specialization, especially in our industry, they try to find a solution for everything that normally is not so like that. So knowing our limits and the limits of each specialization, I think it's the most difficult, but it's there that we can help more the patients.
I think that's the most important. Actually. The most important. So how do you think dentistry has changed in terms of restorative dentistry? Because we used to just learn composites, that's all. But nowadays, with the things that we have, how do you think it has changed the way we are able to do conservative and preventive dentistry more than, say, 10 years before or 20 years before?
I mean, there's obviously evolution on materials, but for me, the evolution on conservative dentistry is more concentrated on early diagnosis. Like, I know today we have 3D printing, we're starting to see 3D printing composites, 3D printed ceramics, guided treatments, incredible aesthetic and functional composites. But for me, for what I do, being capable of avoiding the use of these crazy new materials, for me, it's the best. Because once again, it's always good to have availability of these materials, but if you can avoid to go there, it's the best. It's in the best interest for the patient. So with intraoral scanners, we use a lot. I think that I don't see anymore in Switzerland. It's Diagnocam. It's like early diagnosis. You can see if the cavity is already on dentin or not. Where are the limits? Should you infiltrate before burying it off? And for me, the real evolution it's there. And sometimes with some colleagues and even with some students, I'm just brainstorming and I start saying like, actually, the prevention should be more valuable, more expensive than putting an implant, because you did wrongly if you need to put an implant, for example. So the treatment should be more expensive, and to show the value of prevention. Probably like this, the patient will realize the true value of prevention.
How do we get that? Because I think a lot of dentists in our profession, due to financial reasons as well, they tend to choose treatment that, you know, at this moment of time perceived by patients that are more costly. But in actual fact, like you say, prevention. How do you think we can change the industry to go towards prevention?
I don't think we can change the industry, because the industry needs products to sell. So this is quite delicate. I think the work must be done in early ages with patients. So actually
but it's education,
but on patients. So
but how do we educate patients then?
You need to spend quite some time since early ages to show the value, to show some success cases, and like everything, communication is the best, because if your group of patients here in your clinic need less and less implants, and the next clinic just on across the road need less implants, and starts to be a trend, the industry will like adapt for the less need of implants as well. I'm not against the implants. I think it's really good technology,
It is.
But it's nothing that replaced a natural tooth. So to change the industry, I think we need to change the mind of our patients, because it's like if there's no need, so there's no need to develop more and more complex implants.
How do your practice look like? Because it's so interesting that it's all prevention in your practice. How do your patients find you, and what do you do in your daily work?
That's a good question, because I was working in a big clinic in Switzerland, and now I'm just starting my own practice with a colleague, and patients have a completely different mindset of mine. So it's quite challenging to change the mindset of a group of a patient, because this clinic that I just bought, they were there for 35 years. It's a dentist that is already tired of working. She decided to retire, and with a colleague, he called me. There's this clinic, so you want to invest with me? Let's see. There's a big potential there. There's a big group of patients. And now since January, we are trying to fight and to show the importance of prevention. And sometimes they don't understand what we are talking about, because we still have, even in Switzerland, because in Europe, for example, when I'm in Portugal, like when I saw and heard about Switzerland, I thought it's like everyone is perfect there, the dentist, the patient.
We all think so. We all think Switzerland, it's like the top country that should be doing everything right.
But it's not. It's definitely not. And I'm seeing it probably in the hard way today. And I still heard, like, on a daily basis, I didn't felt pain, so I didn't came. So I think the phrase that I say the most on a daily basis as well is, you don't need to feel pain to come to see. So I start showing them, actually. My first appointment is like almost 1 hour appointment to collect data, and showing the importance of the data collection, first of all, and then actually show the data. Because when I was younger, when I was not in this part of the conservative dentistry, I was collecting x-rays, diagnocam, impressions, and pictures, and all of this stuff, and I was just keeping to myself. I have this, I have the records, and the message was not passing to my patients. So I actually collected in the same appointment. I say, look at this, you see this? So with all of this, I will think in a way that I can help you, but just already take a look at what's happening in your mouth. And in Portugal, we have a saying that image speaks for 1,000 words.
Yes, that's right.
So this is my strategy, at least for now. Probably in a couple of years it will change.
Yeah.
But to change the mindset of these patients, I'm using a lot of images,
Photos.
STLs, and interactive features. Yeah.
So what do you look for as a prevention restorative dentist? Because, for example, like as our patients come in, we are perio practice, we are looking at perio. Or what do you look for in your practice? Do you look at everything? Occlusion, gums? I'm quite sure we have to do the basic stuff. But specifically for prevention and restorative, what is it that you look for in the patients?
Like I look straight away. I ask a lot of his methods of if they are brushing, if they're not brushing, flossing. I try already to understand what they are doing at home to prevent the decays and all of these problems. I also try to understand the habits, what they are eating, if they have his Coke for a long time in a day, or just sometimes I even tell them, probably it's better to drink 2 liters of Coke at once than having your little bottle
every
of Coke
20 minutes and the saliva just keeps going down.
Exactly. So I try to understand in the first appointment all of this, and then to see signs of decay on mouth, collecting like bite rings, periapicals, photos, and special this. I know they already talked about this 3 times, but the diagnocam is the must, because you can understand at what point the decays are going and going more and more deep on in the tooth. And then, like, if you understand already this, you can like adapt to the patient, because imagine you have probably 3 decays only on animal, okay, but the patient has good habits. Probably you'll prioritize more conservative treatments like cavity infiltration, or it's not a cavity, but like decay infiltration, instead of starting burying and creating cavities. But if you see the patient doesn't have good habits, and you have like 3 or 4 decays and they are already deep, then okay, probably the infiltration is not going nowhere. So there you need to be probably a little bit more invasive and start doing actually composites and things like this. But but I'm also looking a lot about occlusion, because Switzerland is a kind of stressful place and there's a lot of wear there.
That's right.
And then occlusion is a big thing there. And if you don't take pictures, if you don't show, they can't see, because the advantage of diagnosing this kind of stuff, it's on the early stages, but to explain the patient,
it's hard,
especially on early stages, where you can earn and win a lot doing preventive there. So unfortunately, we're just doing this kind of treatment when it's already too far.
I think most of the time dentists are trained to fix problems when the problems are so obvious, and unfortunately patients also come late. So I think the concept of prevention is very much on oral hygiene instructions, gum disease, but they don't really talk so much about the wear and tear, how to prevent that. And they talk about cavities, but nobody really likes to talk about the fact that there is wear and tear as well that goes on, and the occlusion that needs to be fixed. So I think that's something that we hope we're going to be able to come out with some reports that help dentists, younger ones.
Of course, this part is really, really important, because I also tell some patients, especially the young ones, to do a filling, everyone can do it. I say, even my mother is not a dentist, can do it, like filling a hole. But when we do it, I don't want to see you next year with another one. So this is the point. You're probably doing reports and taking time to explain and like that, and then digest this data and explaining to the patient.
That takes a lot.
And this will help us on prevention.
For infiltration, it's been a topic of interest for quite some years now. When did it take off? Because up to today, it hasn't really taken off to a lot of dentists, especially I think in a lot of countries as well. People don't take this seriously. And for you, I'm very sure this is serious business. And for patients, if they understand that there's such thing as infiltration to protect, why wouldn't they do it? So when do you see this major shift in dentistry happening? Or
Yeah, all of this infiltration subject started with a brand. They call it was with DMG and Icon. They started developing it for interproximal cavities. Decay, because
decay.
it should not be cavitated to be able to infiltrate it. But the results were not quite
so
good there. Even in the University of Geneva, we have this protocol is not used with a DMG product, not with Icon, but we managed to do it ourselves to create space in interproximal spaces with orthodontic rubbers. You put leave it like this for 1 week, and then we can create a space to pass our etching, to pass our infiltration resins. But it's working good, but in some patients that can allow a good hygiene afterwards. But the true shift is on aesthetic and upfront teeth, because we have some of fluorosis, some of white spots. And here I see the big shift and the really value of this treatment, because you want to reduce the contrast in between the white spots and the
normal enamel
and the animal, and like this you'll be less invasive. See, even if you want to do like composite restoration or composite aesthetic restorations, if you leave this white spot, you will you need to work to hide this white spot. So you want to reduce the contrast, so you can either way you can use a bleaching product to bring the color of the tooth up, and infiltrate a little bit this white spot, like this, reducing this contrast. You will be able to
get better results.
Exactly.
So
and sometimes it's enough.
Oh yeah, it's true. I've seen cases where patients are very happy and they don't even need anything else, and I think that's the best way.
And this is a good point. When you do conservative, micro-invasive aesthetic treatments, you know that you want to achieve a kind of result, but you need to explain the worst case scenario to the patient. But you need also to explain, okay, this is my plan, but my plan can stop like only on 1/3 of this treatment, because to achieve this, sometimes only with the whitening it's okay, only with the alignment and whitening it's okay, only with the alignment, whitening and infiltration we don't need the composites. So we need to explain this kind of flexibility that most of us don't have too much to the patient, and the patient here they quite like it.
No, I think most of the time why we're also doing this podcast is the fact that we want to bring joy. And the joy is when patients are happy, and the less we do, sometimes the patients are happier.
Once again, stretch the life of the tooth. You never know. Probably when you'll have like 70 years, then you probably you'll try everything. You redid a lot of stuff, and then we can try at this point probably do a veneer or a ceramic, but try to be less invasive possible, especially in the early ages.
That's true. That's true. Unfortunately, most dentists are not giving patients the option, and sometimes very quickly we make decisions because we are trained to solve the problem with a treatment protocol or just a product. And I think we need to start thinking back, because general dentistry, do we teach infiltration now in the undergrads?
In Geneva,
In Geneva,
I don't know what I are doing now in Portugal anymore, because it's almost like 13 years that I'm away, but I didn't learn this in Portugal. But in Portugal, I was learning to do like this black cavities, and in Geneva they upgraded. We don't burn anymore. We don't have the need to do black cavities, because black cavities were used to stuck amalgama inside. So with adhesion we don't need this mechanical retention, so they avoid it. We don't train the students neither, or almost nothing, about the crown preparations. We only do crowns when we need to redo a crown. We never, or
do
almost
a new crown. That's
Never.
amazing.
Yeah.
That's
Yeah.
amazing.
Yeah.
Because I think one of the biggest iatrogenic
Mhm.
things that we are doing on patients is putting crowns on patients.
Mhm.
Unfortunately,
Yeah.
it's not a foolproof thing. Yeah, it is not.
So the professor that time saw we don't need. So we don't need to teach students to prepare crowns. And I
Wow.
find it amazing. Yeah, we don't need.
Wow.
Because even if you redo a crown, the preparation is almost there.
Yeah.
So
There's
just
no
need to
need.
clean it. Yeah.
Yeah, because you want to protect as much tooth as possible, and you don't try and cut and create retention and stuff like that.
Exactly.
Yeah. Oh,
Yeah.
that's so amazing.
Yeah.
We should spread this out.
Definitely.
We
Definitely.
have to, because majority, I think 99% of dental schools are still teaching crown preps and
And I loved
restaurant.
it.
Yeah.
When I was preparing my plastic teeth, I love to do it. I love it. Like once again, I was really manual. I was like spending sometimes watching the angles and this is parallel or not.
Yeah.
Yeah, it's quite amazing.
And you don't do that now.
No. No.
No, that's interesting.
Yeah.
Because this is another level of dentistry that
Yeah.
we are at now. And I think a lot of people don't realize that this is coming.
Yeah.
And the more we do this, the better it is for our patients as
Yeah.
well. Yeah.
Definitely.
Yeah. And with the materials that we have, we can actually do a pretty good job of what we do.
Yeah, definitely. Especially with the new materials. I'm quite impressed. But
Yeah, good.
Mhm.
Good. For the young dentists that are listening out there,
Hmm.
what advice would you give them on which path or how should they start if they would like to be someone like you?
Oh, I don't know if someone wants to be like me.
Oh, no, I'm quite
I don't
sure
know
that
if
will
it's a
be.
good thing,
Yeah,
but at least you have to have this philosophy. You need to look to dentistry not like only to earn money.
Mhm.
You need to be inspired.
Mhm.
Also, you need to like to go to the dental office and actually enjoying being there, and not only for money, not only to show off to your colleagues or to your peers, but especially to help the patient. Like if you really like to help the others, the first one should be helping the patient with the treatments. And if you find a specialization on dentistry that really fulfills you, this should be the way. And if everyone knows inside what they like, yeah, everyone knows where they are good at, what they want to develop more, and they just need to try things in the beginning. Don't be afraid of trying, even if you don't like it. I was surprised. I was in pathology,
Yes,
and
you were a completely different route.
You will just need to be open to try, go see. You don't need to start a master of orthodontics or restorative neither. You don't need to be a best implant already at 25 years old. Just go and see, because you don't know, the things change.
Yes.
And I took a shift on my professional really early, and I was trying other things. So don't be afraid of trying. And when you find your passion, then use that passion to be the best or good at it.
Yes.
Because this passion is the fuel to improve your practice. This would be my advice.
Yeah, that's it's being passionate about what you do rather than trying to force things. And
because everyone wants to be and to have to be in the most known program. They want to go to NYU straight away, and then to go to Geneva, or doesn't matter. You don't actually need. You actually spend probably to be an orthodontist or to start an orthodontic program in Geneva. They cannot apply if they don't have at least 6 months of general dentistry to be really sure if this orthodontics is the way to go. For example.
It's true.
Yeah,
it's true, because a lot of dentists sometimes, as dental students, they graduate, they think they're very sure they want to go into something, but without practicing general dentistry for a period of time, you actually don't know.
Definitely.
You don't know. You don't see your options at all. So a lot of people talk about Prost. And the Prost crossover between Prost and Resto, and they always say Prost is the boss when you do treatment planning. What do you think about that now, given that you are into prevention, more than treatment planning of major reconstruction? Well,
there's a quite up-to-date question, actually, because even in our departments, there is a quite of like the information doesn't flow really easily, even in university.
Yes.
Okay. Because Prosto, Restorative, sometimes they do the same things with a different vision. Some departments want to have the lead, or some, not departments, but some dentists want to have the lead. And I don't see it like this.
Yes.
I see the main goal is to understand the need of the patient, to try to have a goal, plan it.
Yes.
But you cannot impose yourself as the leader of the plan. It's funny because we already speak a little bit about this when we had lunch. But yeah, like doing a home or doing a house or preparing an apartment, you need to have a blueprint.
Yes.
And normally in construction working, it's an architect, and here the architect needs to be a group, needs to be a team. I know we have kind of and some stubborn colleagues in Prosto and surgery. They know it. I know everything.
Yes.
No, you should be humble and flexible and open to learn from others.
Yes.
And everyone has a place to say and to have a word on the treatment planning.
Yes.
So if especially, for example, in my clinic now in Switzerland, my colleague is a Prosto, is someone from the program of Irene Saylor, and we sometimes we can do the same work, but we said no, there's no egos inside of this door. Let's say and let's discuss, let's plan it together. You'll know definitely things that I don't know. I know definitely things that you don't know. So let's be humble and open enough to learn with each other, plan each other, and the final work will be more adapted and way better for the patient. The main goal here is always the patient. So you leave your ego outside and don't take over your colleagues. Just be open and collaborate. Teamwork.
Yeah, I think teamwork. Because we no longer can practice solo. And a lot of people think that, you can practice solo, but I think dentistry is changing so fast. And you can't do everything yourself. It's almost impossible. You can, but we may not be very good at it. That's all.
If you have no option, if you're the only dentist in your clinic, then it's good to have your ego. You're capable of doing everything. But I don't, I don't see dentistry going this way.
And I don't think it's also fair to the patients, given the technologies that we have now. We are able to see things far more than before. Like, you were not probably able to do micro prevention stuff if it's not because of development of technology, materials, and everything else.
Definitely.
So dentistry is changing so fast that what you do, I don't even have a clue of what you're doing, because we were trained in the old days where you've got to cut crowns, you've got to cut teeth. And
I actually think I'm quite up to date with dentistry, but I'm having big trouble to follow up the evolution.
Yes.
Every day,
and you're so much younger,
Thank you, but I don't see it anymore like this. But every day there's something new, and you can be actually overwhelmed with this evolution. Once again, humble yourself. Be sure you learn the correct things, the correct protocols, the bases, and then you can
decide what needs to be done.
Yeah.
What is the best kind of enjoyment or fulfillment when you treat them with prevention? What were the best words that patients, or do you have a story to tell or to share?
Now it's the patient, but I was not always like this. In the beginning, I was probably with every young dentist, because to do my program, I needed to deliver amazing content. My rubber dam should not have a drop of water. So at that time, my main goal is to have the best picture ever to show off my work. And this is a bad thing. It was a good thing for my program, but it's kind of selfish, and now that's shifted. I really, really pay attention to the patient needs. I'm open to listen what they are really asking for, and I try to focus and deliver what they're asking for. Sometimes the patient don't know that they have other problems. It's your role to also tell, if you don't mind, I saw other problems. Are you interested to hear about it? They are really important. And then at least you inform. If they take the message, you do things correctly. If not, your job is also to do what they ask. And if probably they will return in a couple of years, and at least you managed to stabilize their situation, you can start from there
to see what happens down the line.
And this is what makes me happy. Listen now to the patient, make patient in the center of your table, and deliver what they're asking. Also informing if they are not asking things. So I love when it's not even delivering the best smile. My fulfillment now is when my message is well transmitted, and I see that they really understand what I'm saying. This is what makes me happy.
That's so important. I think you've transferred, because the work that you do, I see the pictures that you take are amazing.
Thank you. Thank you.
Do you, because I saw some of the photos, do you still do a lot of orthodontics before every single case? The teeth are so well aligned, and then when you do the restorations, they look so good. Because in Asia, we don't get teeth that are so well aligned most of the time. You know, I'm not even sure we can get the kind of contact with the restoration. How do you treatment plan?
My treatment plan, that's quite, that was a big evolution as well, because I was only seeing the when I was younger and probably more lonely, I was always looking for restorative part. Doesn't matter the position of the tooth. And now my workflow is more like this. Like I first is taking the message and the need of the patient, and collecting data. With this data, we'll my team will plan the final situation, and then there's a couple of steps that need to be done before achieving this final situation. And we need to be a little bit of to have a little bit of flexibility. There's the first step is the healing phase. The perio needs to be stabilized. If there's a perio issues, you can do whatever you want to a tooth, but if the bone and the gum,
that's the most important specialty.
So
joking.
You can, no, that's true. That's actually true. But and then you need to stabilize that, stabilize the hard tissues, avoid any kind of fissure, like really the healing phase. And this is unnegotiable.
Non-negotiable.
Exactly. This is the step. Is not, you cannot wait. You need to be like clean. Everything needs to be clean. It's stabilized, and then, if possible, you align. You align what you can. Okay, doesn't need to be the most crazy orthodontic treatment, but you align, because alignment also comes with the function, and if you have a better function, your work or your restorative work will last longer as well. And when you align, you also create the correct spaces to probably to a missing tooth, to have an implant there, and then you go little by little to Prosto. So this is my workflow. But if the patient doesn't want the orthodontic part, because most of them don't want it, my role here is to make them understand that it's still possible. We can go for the reconstructive parts, but probably it won't last as longer that it should be. So once again, transmitting the information, we have a main goal. We know the road to go, like a GPS. When you put home, you have the blue line. It's the quicker and the more efficient way to go to achieve and to go home. But sometimes there's
another option.
An accident. Here you have another option. You can still go there, but you need to adapt. You need to be flexible on it.
I think being flexible, it's also another point. We as dentists, we are trained to just be very specific, but being flexible is one important thing.
Really. Humble and flexibility.
That's true. When it comes to the field of restorative bonding materials, do you think that, I'm going very technical now, what do you think is critical for success? Is it the materials, or the dentist training, or is it, what is it that is most important in your kind of view? Because in your field, you depend a lot on materials and techniques. And is it the dentist? Is it the materials? Or is the techniques?
I mean, I think it's a mix of everything. The dentist needs to know a lot and know everything about it, because you can have the most and the strongest material, for example, like zirconia, but if you don't have enough thickness of it, it's also a weak material. So the dentist needs to know the limits of each materials. Sometimes, once again, we always try, and when I was on my program, I always tried to be less invasive possible. But sometimes being less invasive, when we do less invasive treatments, you tend to not create enough space for the material, and this is an error as well. Sometimes being micro-invasive you don't need to touch more tooth. You need sometimes to touch more tooth to be able to have enough thickness for this material, and like this the material will last longer. So I think it's a mix. It's the material and the knowledge of the patient, of the dentist,
and how to achieve it.
Studying it. I was like, I spent a lot of time learning.
How many years in the end?
It was 2, but non-stop. I don't remember how much time I spent learning elasticity models, resistance to fracture of each material, and then each brand has a different name for the same material. You have 1,000 of blocks. And it's a big mess. So you need really to go deep on it. And in a certain way, sometimes it clicks. And you have the feeling that you know nothing, but sometimes
it just clicks.
It clicks, and you know everything. So
no, that's amazing, because we would love for people to be able to enjoy this, and we all need to learn French now in order to get into the program.
Je parlerai en français.
There is a lot of Instagram dentistry now, and you are big on it as well. Where do you think this is heading towards, with people trying to copy what you do and telling patients that this is what you do as well? Or what do you think?
This subject we could stay a day or two speaking
talking about this,
because there's so much good things and there's so much bad things at the same time. Because, at least for me in the beginning, posting some dentistry contests was making me really picky with my treatments. So it was a way that I found to keep me motivated to do perfect work. Because if you don't take pictures, and if you don't want to share your work, even if you don't want it, your quality will go down. So it was a way that I found to myself to keep up with the good work and show. This is a good thing. When I was in Portugal, I didn't have access and possibility to learn from abroad. So this is a good thing as well. You can have access to more information. But the information that you find on Instagram, for example, on social network, is not professionalized. You can have all kind of information, good one, really good one, and really bad one, because you don't have a filter to know if this is the really good thing to do, if it's backed up with science or not. So that's why learning by ourselves and having a critic spirit, it's the way of enjoying the most the Instagram dentistry. Because if you know, if you study on the side, if you have access to scientific articles, if you learn not only from Instagram, you'll have a solid knowledge, and then you can go there, seeing the pictures, seeing the treatments, and oh, this guy is doing completely stupid stuff. No, this guy is really, really good. So you cannot only take Instagram dentistry as the main source of information. It's a really good thing, but you need to be critical about it.
And I know you're working on this project to make sure that we find a safe space for
we will.
people. Yeah, and I can't wait to share that project.
Me too. I don't think if my partners allow me to speak too much about it, but
not yet.
Not yet.
Not yet. No. So coming back to restorative dentistry, do you do smile transformation as well? Because there's a lot of smile design, DSD, one of them, and Smile Cloud. Now, everyone is talking about smile transformation, and it is advocating, and a lot of clinics are using that to just, create height. How is that fitting into prevention and restorative dentistry? Yeah.
I mean, I think these tools are amazing to communicate, okay? But once again, you don't need to take it as granted for every kind of patient, okay? It's good to use it more to communicate with patients and with the team as well. This is once again, the main goal, but sometimes what we show is not doable. It's too much. The patient probably does not need to do work until the first molars.
Yes.
And you need to step back a little bit, use it more as information. And then on a most conservative way, apply this to the patient demands, because sometimes the patient don't want a smile makeover.
Yes.
They just need, for example, I'm working really closely with orthodontists as well, with Nuno Sosias. He already came to your podcast, and sometimes, especially on younger ages, doing smile makeovers, you can do it. But in a more conservative way, probably, and if you can, being additive. And you need to explain to the patient that, this is the image you can do with digital smile design or Smile Cloud. But to be conservative, if we don't want to touch your teeth, we just want to add. But by adding, you have limitations. Yes. So these images are a dream, and we don't want to touch your teeth, we just want to add, so it will be something really close to it, because most of the smile designs are resective, so you need to cut to be able cut gums, cut bone, cut tissue, and I'm not this kind of guy. So probably, if you already went through all this preventive and conservative treatment, you're already tired of having composites, you're already tired of having to polish them each 5 years. Okay, you have 50, 55, 70 years old. Okay, let's go for a more invasive treatment. But at the early ages, I actually tell to my patient, if you want to do it, I'm not the right dentist for you. You better go to see someone else. Actually, you need to be this kind of confident, because probably probably will deliver the what the patient is asking for today, but in 10 years, they will return with problems, and they will be disappointed with you. So I prefer to do all the way around. I want them probably to be mad at me or not so happy at me in the beginning, but understand later. And when they return, they say, "Oh, you were right.
Yes.
That's the opposite. No, you were wrong." So I
love that concept, because that's how we did it as well with Pero in the early days, because sometimes you just have to turn away patients, especially when they are young, because we know that there is a life cycle of materials. Even very good materials, there is still a life cycle. And if it is invasive, in time to come, in a young patient, they are going to outlive the material and things are going to happen. And it's better that we have more tooth structure to work with than not.
Exactly. That's the whole point.
That's a very key message to a lot of dentists that we hope today we're going to be able to share with.
Exactly.
What's the biggest misconception now? I love to ask this question. And social media platform now that worries you the most. What I mean is there any social media messages that are really in trend now there's a big misconception, for example, be it smile design, or everybody can have this beautiful smile, or things can be fast, and that prevention, maybe go back to prevention a little bit more, as that prevention, once you prevent, means nothing will happen, those things.
The misconception of social media is probably not too much to the dentists or the practitioners, but more misleading patients.
Yes.
I think it's the most concerning thing, because as you just told me, we're showing and we are trying to show quick and perfect results for everyone. This is not a thing. Not everyone can have a perfect smile without paying a price. I'm not talking about money. I'm talking about biology. So this is for me the biggest misconception is having a perfect smile. It's available to everyone in one day. It will last forever. No, we need to pay attention and to make patients understand that this comes with a price and it's not forever. And it's most of the time by cutting what we don't need to cut.
Yeah, that's true. It is not to pay a price with biology and end up sacrificing things that we should not be sacrificing.
Exactly.
Yeah, and I think a lot of marketing now, and sometimes even just ortho or perio or they're doing deep scaling for just because they are worried about bacteria. They're doing deep scaling when there's no pockets. Even
the orthodontist, like. In the orthodontic treatments, I deal with a lot of orthodontists, and some are big fans of aligners. Some hate aligners. So, but each option, the brands sell it to us like as the only or the perfect option. And today we know that only alignment probably is not enough. And only brackets probably is not enough. So once again, flexibility. I know some orthodontists that start probably with brackets, and the patient doesn't like too much, but most of the work is already done, and then they remove it and they do aligners. So flexibility. Don't be stubborn.
Don't be stubborn. I like that one. We don't be stubborn. I think we're trained to be so stubborn in the ways that we do, and sometimes it's not a good thing.
Because we are used to protocols. Protocols make us like really strict. And everyone wants to have this protocol. Everyone that don't want to think about things. And since early ages, we are in dentistry, we are used to protocols. So it makes it kind of not so flexible. But you need to study to understand what you need to be really strict and what you don't need to be really strict. There's not flexibility only or being strict only. You need to adapt. And this is the main goal for me.
I think the main goal of adaptation, that's a powerful one.
Yeah.
That's a powerful one, because we all need to learn how to adapt, because most dentists are trained to just think about something and have to do something certain way, or they want to learn a technique from somebody who is famous and they think that they can bring it back and that's it. But it is actually the situation that you need to decide how and what to do more than anything else.
Definitely. Yeah.
That's good. Do you think we're going to progress even further with our industry in terms of restorative dentistry?
I mean, there's always place for improvement. Even if we don't see any future to it, every year or every day I'm amazed with the new technologies, because I was the part that bring me into restorative dentistry was the capability of doing things with my hands. But doing things with my hands is kind of my artistic feature, And sometimes being artistic is not so good, because you're planning a thing, and if you add if you're doing it by hand, you add a space for error as well. So at one point, I thought being guided was already the limit. So I planned this. I have keys. I have guides to put what I was thinking about on the computer into the mouth of the patient. And I thought, okay, the guides are
perfect.
We don't we cannot evolve anymore. It's perfect. I plan it. I can put my plan into the mouth with keys. And now there's 3D printing. See, so 3D printing probably now they are trying to develop better resins, better ceramics to 3D printing. But with 3D printing, we don't need any more or not so often the keys are being guided.
Yeah.
So probably there will be something in the near future that will also replace 3D printing.
Yeah.
Yeah.
And be able to do the diagnosis for you at the same time and fix everything much faster and cut down the patient chair side time.
Yeah. With AI. Yeah. I don't know. Imagine if you have a patient with wear and with AI learning the features of the face, probably they will already suggest a design from when they had 6 years. I don't know. You can dream. Today you can dream about stuff. Yeah.
Everything.
Especially here in Malaysia. I've been dreaming a lot of the possibilities you have here.
Thank you. I think we have a lot of possibilities. That's why we're doing this. We are hoping to open patients as well as dentist mind, and lots of interesting things will be coming.
Definitely. Yeah.
Good. How do you think in 2025 now, looking forward with the young ones, do you all think that with the kids especially, is it time for kids to also look into prevention with what you do? Because that is one topic. Everybody thinks that infiltration is only for adults. I'm going to go back a little bit on that. Do you think it's time for kids and pediatric dentists to even understand this part? Because the pediatric dentists are trained to do prevention, but it's always fisher sealants, things like that. Do you think it's time, or it's still not safe for kids? Yeah.
The prevention? I think it's the main goal of prevention. Like prevention, what is prevention? It's to avoid future problems. When is the best time to avoid future problems? It's on early ages.
Yeah.
So if actually for me, prevention comes with the word pediatric dentistry.
I was going to get there, but no, because a lot of restorative dentists would only like to deal with adults, and a lot of them don't want to deal with kids, but there is no collaboration. I don't see that. I see it as everybody's on this side and everybody's on this side, and we're not crossovering.
Yeah, people are fragmented in their specializations. Yeah, definitely. I mean, I really love kids doing treatments on to have the kids as patients, but for me it's really stressful. So, and with my beer and my appearance, I don't know, probably I'm scaring them, and it makes me really hard to treat them. So I have some colleagues, some pediatric dentists that work with me, and we almost have the same philosophy. I learn a lot with them. They learn a lot with me. Prevention, it's the biggest thing, but don't forget, because kids still have teeth, so the restorative part still needs to be there. And but most of the times we are getting lost on treatments, just cavities. There's so much patients, we don't have time for prevention. But for me and for my colleagues that do pediatric dentists, once again, it's in the beginning. Even when they come for the first time to the clinic, we do we try to collect the most data possible, but the parents are there for the first appointment to understand the needing. Because when you're a kid, probably you spend an hour talking, and you need to brush your teeth 1,000 times per day. They say yes, and they won't do it. So at the first appointment, to have the parents in the room, it's really, really important. Also to make them understand what's going on the mouth. And afterwards, we little by little need to transfer the responsibility of it to the kids. So the next appointments, the kid only comes alone through to the treatment. And we are kind of impressed. This all crying and screaming is not there anymore, because they don't have the parents to be to do this. So and we do all the treatments, and in the end we spend again some time alone with them, because we took these appointments as a growing procedure as well, and they are already more mature. And we sit with them. Okay, so you just spent 3 or 4 appointments with us. It's not bad, but it's not so nice neither. So the point here is to avoid this in the further future. So it's there after treating them most of the time, because we don't have time to do it another way, that we spend a lot, again, 1 hour almost to show the need and the importance to come once per year or twice per year, but just to check and giving them the info and the tools to prevent. Yeah.
I think what I was trying to angle more towards was micro-invasive procedures are not very much used by pediatric dentists as well. And so these kids, they grow up with their first molars even at 6 years old, and a lot of the permanent dentition are treated differently just because we don't understand what you do. And I don't know when, and I hope that one day we can get that crossover.
Yeah, me too.
We're hoping that we get your crossover of your knowledge and your expertise into pediatric dentistry, because that's the first time we will catch them. And the more we catch them at that time, the less invasive they become.
But it's quite funny because that you're talking about it. Now I understand what you were trying to say. There's a program of pediatric. There is not anymore. I don't know why, in Geneva. And the first year of my program, we were doing it together.
There you go.
Yeah, it's the group was bigger because the program of pediatric dentistry was only 1 year, and mine was 2 years, 3 years and a half. But when we learned the concepts, prevention, we were doing it together.
Yeah, there you go.
There you go. There you have your answer.
I have my answer. Because it's so important that we see each other at that point because of micro-invasion. I think that those techniques, those are the things that we need to do in dentistry now, more than fillings, restorations, crowns, and smile and stuff like that.
Exactly.
No, but thank you for bringing so much happiness to our podcast.
Thank you.
And for bringing joy to dentists and making us realize that the future is actually less and less invasive dentistry.
I hope so. We hope so.
Yes, and make everybody smile better.
Yeah.
We started this, and this is for you because we are supposed to make every day a little bit more joyful. And I think what you do definitely signify that. And thank you.
Thank you so much.
You're welcome.
It's quite funny because my colleague in Switzerland, in his office, his kids gave it like a long time ago, and I was like, what is this? Tell me, what is this? Oh, my kids give me for happiness. If I'm tired, I look at it and I feel happy. And it's funny. I come all across the world and I find the same thing. I will have mine on my office as well.
Now you have yours on the same office. Well, we started this because we wanted to create joy for everyone. And I think dentistry is kind of, you've gone into such subspecialty that a lot of us dentists don't even know about. Like, we don't do what you do, today, and yet you're bringing so much joy for patient, and it's not being spread out. So that's why we're sharing this. Thank you
for having me.
No, you're
welcome. I had an amazing experience here, not only on the podcast, but what's going on the sides. And you guys here are amazing.
Thank you.
And we don't see this kind of happiness in Europe anymore. We need to learn a lot with Malaysia.
No. I think it's a team, and it's because of the people that we meet. We need people like you that inspire the rest of us, and that's how we get things done. Thank you once again. We will definitely see you back.
Bye bye, guys.
Bye.
Bye.
Bye.